Hi and welcome. I'm trying to learn medicine. Today, Angina Pectoris. And after we've done that, we're going to do squat training. And if you participate in the squat training, then it's been at your own risk. And we're talking about internal anatomy and the blood system. And this is the third part of Angina Pectoris. And we're trying to collect together information we have, to memorize them, and then make a little presentation in a separate video. So, Angina Pectoris. These are attacks of choking and throttling pain across the upper part of the chest. Now we're having written here by the symptoms. It is never throbbing or knife-like. Now a throttling, that sounds like, I don't know what these both terms are, but throttling, that is what I think a car does, or a motorcycle. But I don't know what these terms mean. So, attacks of choking and throttling pain across the upper part of the chest. And that is because the blood supply to the heart through the coronary arteries is limited. And the main reason for that is atheroma. And atheroma is when fatty deposits are deposited at the arteries. And the main things to prevent atheroma to happen are to listen in this book under atheroma. Again, I didn't say that. This is no medical advice. I'm just reading about it. And so atheroma, the main things to prevent it in this book is said are to stop to smoke or not to smoke, and to exercise, and to not be overweight and not to overeat. There are diseases like anemia which produce the same type of pain. We try not to say it. Okay, it occurs in spasm and is usually brought on by exertion and relieved by rest. Okay, that should be said also. Okay, the symptoms, let's make all symptoms here together. The pain usually begins across the upper part of the front of the chest and can spread to the jaw and down the left arm, sometimes the right also. Okay. I don't know what it means, it comes in spasms. So let's stay away from it, I don't know what it means. It is a pain which comes if people do exertion and goes away if a person rests. It is a throttling and choking pain, and it comes across the upper part of the chest, spreads to the jaw and the left arm. The pain can be described as tight, heavy, constricting or crushing, and sometimes numbing or burning. It is never throbbing or knife-like. I think I know what I mean. Because a heart attack would be throbbing or knife-like. I think that is what I mean. But it is no medical advice, I don't know. The pain can be described as tight, heavy, constricting, crushing. Tight, heavy, constricting, crushing. Okay, I think we have it. For a few minutes, and it can become through exertion or also through a hearty meal, and passes them off with resting. And basically, once angina develops, the attacks usually recur. Now, the next thing is now causes. Exertion, so if people have it, if they get exerted, or also cold weather. I think that's interesting, cold weather. And strong emotions can also cause it. We could list argument, shock, violence, or excitement, hopefully just on television. Heavy meals, and can also cause it. Okay, exertion, strong emotions, heavy meals, cold weather. Complications. A clot may form and block the coronary artery and cause coronary thrombosis. It can happen that such a clot of these fatty deposits forms a clot and it blocks the arteries, causing coronary thrombosis, which is a heart attack, a type of heart attack? I don't know, but it must be something like that. Treatment in the home. Sit down and rest. Okay, what do we have that's next here? What do you want to say? Because this is now medical advice, we want to talk about the angina pectoris. Find out the cause of angina and assess its severity. If it is mild, no treatment will be needed, but if it is serious, then various medical treatments are available. If it is not responding to medical treatment, the diseased artery can be surgically removed and replaced with a vein graft are opened up by inflating a tiny balloon in the artery, angioplasty. Okay, we could say if a situation does not get better through, where we could say your doctor may prescribe tablets which you can safely take before exertion to prevent the onset of pain. There are medications against it, and also the possibility of surgically removing one of the coronary arteries which have the ephemeroma, in cause when the Angina-Pectoris, or to open and inflating it with a balloon, angioplasty. Long-term prevention is not to smoke, to keep the weight down, increase physical activity, but if person have it already, it should be all talked up with the doctor. Well, let's read what I said exactly. Increase physical activity, but avoid precipitating an attack of angina by using your tablets if necessary. Physical conditioning by exercise often reduces the severity of angina, but be guided by your doctor. Okay, and under proper guidance, when also physical exercises can improve the situation. Outlook. The outlook for angina sufferers depends on the underlying cause. Even when the coronary arteries are diseased, reduction of weight and stopping smoking may relieve angina completely and may also improve the conditions of the arteries. Okay, what we have, angina pectoris. The symptoms of it are throttling. It is a throttling and choking pain across the chest. It starts across the chest and spreads to the jaw and down the left arm. Sometimes also the right. And the reason for it that the coronary arteries, which are supplying the blood, the heart with the blood, are limited in their supplying to the heart of blood. Right. And the main reason is epheroma, that is fatty deposits, and that causes them to get to harden, that is called stricture, now that is called sclerosis, and also to narrow. To harden, that is sclerosis. Was it negative? Fatty deposits develop on the artery walls, which then harden, producing a condition known as sclerosis. The deposits enlarge into plaques, which together with the sclerosis lead to narrowing of the artery. Now, that is that, and then we're having, it comes on, when if people have developed this angina pectoris, it comes through exertion or hearty meals or cold weather or strong emotions, and it should go away through resting. There are also tablets to prevent attacks from happening, but overall, the epheroma has to be full, and the people have to not to smoke and to do exercises and to get their weight down if these are the causes of it, and that should bring it down. There are also surgical operations that the diseased coronary artery is removed or the balloon inflated, which is called angioplasty. I think we have it. I'm going to stop the second camera. Angina pectoris. Angina pectoris is a pain that starts when people have developed it after exertions or hearty meals or by cold weather or strong emotions. It starts as pain over the chest, upper chest, and spreads to the jaw and the left arm. It is constricting, crushing, maybe burning, tightening type of feeling, and it is brought on through exertions most of the times. Now, and the reason is that the coronary arteries are not properly supplying blood to the heart. And the main reason for that is epheroma, and that is that fatty deposits have deposited at the arterial walls, and that causes them to harden, sclerosis, and also do then through plaque forming narrow. And now it usually lasts for a few minutes after exertion and goes then away with resting. There are also tablets to reduce the probability of attacks, and if it is severe, then also a coronary artery can be removed or with a balloon inflated, and that is called angioplasty. And it can be also severe if a blood clot forms and blocks such a coronary artery. The main things to prevent it from developing in the first place, or when people have it, are to not to smoke and do exercises and try to have low weight and not to be overweight. And such exercises must be then guided by a doctor. And that is according to Keith Hodgkin's Family Medical Advisor's book, page 74 and 75, but this is no medical advice. It was so short, did I forget something? But I think I said it good. I'm going to stop the camera. And that was the medical part. If you were here for medicine, this was no medical advice. If you were here for medicine, then you can go directly to the next part of medicine, where we will do medicine. If you stay here and participate in the squat training, then it's at your own risk. And we're starting. Let's do a little stretching. One leg up, pull the leg up, point with the toes down, and relax the leg. On the other side, pull the leg up, point with the toes down, and relax the leg. And now legs wide apart, and we're doing 12 squats. We're going down to the first one and to the second one, and now to the third and fourth one, and number 5 and number 6. We're having the half, and now to 7 and 8. And let's make the first 10 for 10, and just the last two, 11 and 12. And now we're having a few isometric exercises. Now the first one is we're going down into quarter squat and pressing against the top of your upper leg, the 6-pack squat squeeze. And we're pressing on the other side, just on one side pressing. So that we're training the obliques. And half down, and press again on the middle of the leg. On the other side. And now down into 3/4 squat and press close to the knee. And on the other side. And up again. And now the fastest giraffe of a water pond. Down into 3/4 squat, press to the knee and go towards it. And on the other side, press against the knee and go towards it again. Press, go towards it and again. Towards it. And again. And last two. And that was it. And already the last exercise, the propeller. Down into foot squat, legs to the, arms to the side, over to one side, press against the leg with a little bend in the elbow, and look up to it. To the middle, over to the other side, press against the leg, look up to it. To the middle and up. Now walk a bit on the plate, and stretch again a bit. Pull the leg up, toes down, and upper leg. Now take one leg at the ankle, make a straight back, and point with the knee down to the ground. Other side, make a straight back, and point with the knee down to the ground. And now, Vahikas hip top stretch, heel onto the ground and pull the toes in. Foot to the left and pull the toes in. Foot to the right and pull the toes in. In the middle and move the leg from left to right. On the other side, heel onto the ground and pull the toes in. To the right side and pull the toes in. To the left and pull the toes in. To the middle and move the leg from left to right. And now, we're ending. Legs wide apart, breathing out. And breathing out. Again. And breathe out. And now breathing close the legs. And breathing out. That was the squat training. I thank you very much, and until next time.